All right, we are excited to get started today. Welcome, everybody. As you come in, we will give folks a few minutes to come into the room, and we will get started in about 60 seconds. So I see folks coming into the room. Welcome. We will get started shortly. Thanks, folks, for joining. And we'll give it about 20 more seconds. I still see folks popping into the room, so we'll give it about 20 more seconds, and then we will get started. Okay, we're going to go ahead and get started. Good afternoon, everyone, and welcome to today's Council on Black Health webinar entitled Walking the Talk, Reflections on Community Engaged Research and Practice. Today's presentation is offered as part of the Council's Solutions to Diabetes in Black Americans Core. This core is part of the NIH-funded Center for Diabetes Translation Research at the Washington University in St. Louis. The Solutions to Diabetes in Black Americans Core provides methodological and content expertise to advance the field of diabetes research in Black Americans. We appreciate you joining us this afternoon. My name is Melissa Witt-Glover, and I am the Executive Director of the Council on Black Health. I'll be your moderator for today. The Council is a national research and action network, and our mission is to develop and promote solutions that achieve healthy Black communities. We work to achieve our mission by leveraging the credibility and perspectives of Black American researchers, other collaborators, and our research partners to facilitate relevant, community-engaged, actionable solutions that positively impact Black communities. The work of the Council is driven by an understanding of the impact that systemic and structural racism has on the policies, systems, and environments that impact people's lives, which directly and indirectly impacts health outcomes and quality of life. Our approach to realizing healthy Black communities is informed by an understanding that root causes have to be addressed because those root causes are drivers of the structural and social environments that impact individual behaviors and health outcomes. Today's conversation will provide an example of community-engaged research and practice. We're excited to be partnering with Catalyzing Communities, which is a community-engaged research project based at the Friedman School of Nutrition, Science, and Policy at Tufts University. Their goal is to work with communities around the country to promote child health and well-being and center health equity. Today's webinar will feature a presentation and discussion about the successes, challenges, and opportunities of engaging communities and building trust in the context of the Catalyzing Communities project. This conversation today will feature a member of the Tufts team and then two community partners from Milwaukee, Wisconsin, and Greenville, South Carolina. So we're excited as we talk today to think about the research, but also to hear from folks who are putting things in practice. We encourage you as a part of the conversation today to post your questions using the Q&A button, which is in the Zoom webinar interface. And I can also see that folks are participating in the chat, so please put your questions in the Q&A in the chat. We will work those questions into the conversation as we can. We are particularly interested in your questions, not only about research, but you have two experts here who are actually implementing from the community. And so this is your opportunity to pick their brains and to find out not only what worked, but what didn't work and what they would do better. So we're hoping to get all that information from them. Please also feel free to use the chat. Those of you who have been on our webinars before know we use the chat window to provide shout outs, to give kudos, to agree, to disagree, to interact with your fellow attendees. We want this to be as close to what it looks like when you lean over and whisper to your fellow participants in person as possible. We are interactive. We love to see comments in the chat. So do that. Also of note, today's presentation will be recorded and archived for future viewing, and we will publish this webinar online and share the link via email as soon as it is available. So let's get started. I am excited to welcome our panel for us today. We have three amazing speakers, Dr. Larissa Catalyzing, I think I said it right. Did I say it right? Close. Oh,
Calancy is close.
Dr. Larissa Calancy uses mixed methods research to inform and study obesity prevention strategies that are implemented at various levels of the socio-ecological model in order to promote health equity. Her work is interdisciplinary and often uses community-engaged research approaches and system science methods. Before joining the faculty at the Friedman School, Dr. Calancy completed her doctoral training in nutrition interventions and policy at the Gilling School of Global Public Health at UNC Chapel Hill, go Heels, and then completed a postdoctoral fellowship with the Center for Health Equity Research in the UNC School of Medicine and with the National Maternal and Child Workforce Development Center at UNC. Welcome, Dr. Calancy. We also have with us Sally Willis. Sally Willis has had the privilege of working with Live Well Greenville since 2011 and has served as the executive director since 2013. Her varied experience in public health settings includes a background in community development, program implementation and evaluation, and health education. Sally holds a Master of Public Health degree from the University of South Carolina's Arnold School of Public Health, go Gamecocks. Sally enjoys spending time with her husband and daughters, hiking and experimenting in the kitchen, and we just learned that Sally is a Swiftie. And finally, we have Dr. Yvonne Greer. Dr. Yvonne Greer is the owner of Why Eat Right, nutritional consultant for healthy living, located in Milwaukee, Wisconsin. Dr. Greer conducts special workshops to promote healthy nutritional and living behaviors. She's been featured on talk radio, TV, podcasts, and print media. She has several books and has co-hosted a 6-part YouTube and Facebook Live series all around cooking and recipe demonstration. In 2022, Dr. Greer provided leadership to 2 grant initiatives that sought to create positive social change in Milwaukee's social determinants of health and child health equity through community engagement. Through community engagement, restorative justice, and collective action initiatives, which is the work you'll hear about today. Dr. Greer's education includes graduating from the Milwaukee Public School System, a Bachelor of Science degree in Dietetics and Experimental Foods from the University of Wisconsin-Stevens Point, a Master's of Public Health degree in Public Health Nutrition from the University of Minnesota School of Public Health, and most recently, she completed her Doctor of Public Health through Walden University in 2022. So let's welcome our 3 dynamic speakers. We are going to start out with a brief presentation from each of them, and then we will open the floor for Q&A. Please, again, along the way, feel free to drop your questions in and we will work those in as possible. So I'm going to turn it over to Dr. Calancy to go first.
Thank you so much. I'm really excited to be here with all of you and with our co-presenters today. So let me share my screen. Okay, can you all see that okay? Yes, okay, great. So I will be giving kind of an overview of a project that we call Catalyzing Communities, and it's an approach for community-led change. So this work is based in Tufts University in Boston, but we work with community partners all over the country, and I'm really excited to tell you about that. So a little bit of background. We think that community coalitions are really key for creating community level change. So a lot of the public health challenges that we're trying to deal with are really big and they span multiple sectors. They might involve people or determinants that are based in education or housing or government. And so we need coordinated action that brings people from all these different sectors together to work together. And so coalitions create spaces, they create arenas for that kind of action. They allow for people to develop relationships and trust across sectors, across organizations. Groups can pool resources. They can also align their strategies with local norms and contexts. And we know that that's so important when we're working on community-based issues and we're trying to build on the strengths that are already existing in communities. And so there are a lot of examples of community coalitions driving change. There are examples in kind of the food space. So the Prince George County Food Equity Council, for example, is really trying to promote access to healthy food and healthier environments in that whole county. Shape Up Somerville is an example of a cross-sector collaboration addressing childhood obesity in a whole city. And then you even have countrywide models. So in Iceland, for example, they have a whole countrywide model for preventing substance abuse among adolescents. So they have students, they have teachers, they have parents, they have people involved in recreation, all working together to try and create an environment that's healthier for their teens. So Catalyzing Communities is an intervention that focuses on coalitions because we know they have great potential and power for changing communities. And here is a diagram showing community partners that we work with across the United States. And we're so lucky to be joined today by Dr. Greer, who is based in Milwaukee, and Sally, who's in South Carolina. And you can see that each of these coalitions, these are sort of like subgroups of or like groups within coalitions. And these bullet points here are the types of topics that the group really wanted to work on with us. So these bullet points might not be everything that these coalitions are working on, but these are the topics that that the smaller coalition subgroups wanted to work on in collaboration with the Catalyzing Communities project. You can see quite a bit of geographic variation across the country. And we also have other partners that we've worked with in the past as well. So the Catalyzing Communities intervention has a few steps, and I'm going to walk through these steps to kind of give a foundation that you'll hear a lot more in detail about how this worked and where it took communities when we hear from the next two speakers. The first couple steps of the Catalyzing Communities intervention is really based on this method called community-based system dynamics. It was developed, this is a book written by Peter Hoffman, and it builds on a broader field called system dynamics. But in community-based system dynamics, the idea is that there are some problems that are really complicated, complex, and building models or pictures helps us get on the same page about what those problems are and how we can intervene. And then this community-based sort of component of this approach really reflects the fact that communities know best about what's going on in their communities, and that there's a real emphasis on building up the capabilities, building up the skills to use models and diagrams and pictures to get people on the same page when it comes to addressing complex problems. So in the Catalyzing Communities intervention, the first even before the step is that we develop really close partnerships with, we call community change makers. These are individuals who are going to be working, we're going to be working collaboratively and co-designing this intervention every step of the way. So we develop those relationships, and then together we define a problem, or it can be a problem or it can actually be a good trend, but we basically want to define a trend over time. And so that helps us understand what it is we're going to be focusing on. It's kind of a touch point that we keep going back to. Sometimes these problems can seem really big, so we want to sort of bound them a little bit, put a little bit of scope to whatever we're going to focus on by drawing out these trends at the very beginning of the project. And it's important that we consider these as trends over time, because we want to understand the systems that are driving these trends and how they've produced these trends over time. And we want to think about what the trends have been in the past, and then what they could be in the future. So we work together to define a trend in a community. Whoops. And then the next step, some examples of trends that have been selected by community partners. This is one example from our partners in Texas. So here we're working with a small community, but we were looking for existing data, and it was hard to find. So we ended up looking at state level data instead of just what was available in their small community. But basically, we wanted to have a general sense of what kind of the amount of youth who are meeting physical activity guidelines. And we didn't have hard and fast data on exactly what we were looking for, even though we knew we wanted to focus on this trend. So we kind of used the scale from low to high. And we had a time frame that was important. So we looked back a little more than 5 years, kind of drew this line to the present. And we said, well, how many youth have been meeting physical activity guidelines in this over this time horizon? And you can see from our understanding of the problem that it kind of goes up and down a little bit over time. There's some variation, there's some gains, there's some dips, and we wanted to explore the system behind these trends. Why do we see this up and down? Why do we see some gains? Why do we see some losses? So that we can hopefully intervene in that system to produce a more a trend that we want to see, which is higher amounts of youth meeting those guidelines. And what we want to avoid is this kind of trend, which is what we don't want to see. This is sort of our feared future, and this is what we are hoping for. So this scoping the problem using a trend really helps us to talk about, well, what are the trends we want to focus on? And then it gives us some boundaries in terms of the time frame we're thinking about, and helps us understand that we're going to dig into the system that's driving these trends. So another example of trends that we've that communities have focused on, this came from our community partners in Worcester, Massachusetts. So they really wanted to understand food insecurity in their community. So they had perceived food insecurity to be pretty low. And then, as many communities saw during the pandemic, it really spiked. And then it came down a little bit because there's a lot of relief, but they feared that it could get worse again. They thought it could also kind of remain stagnant. And what they hoped for was this future trend that was more in the downward direction, indicating less food security over time. Another example, this one came from Milwaukee, and here they were really interested in, among other things, thinking about the number of children who are achieving optimal milestones in development. So thought it was, if you think of all the children in Milwaukee, we wanted to see more children meeting those milestones and not fewer over time. So those are examples that kind of helped us define the problem or the trend that we were going to be focusing on within the Catalyzing Communities project in a particular community. And I spent some time talking about that because that's a point where the project really starts off on in a way that is very community led. So we have a lot of conversations about what should this trend be. What are the systems that that community groups and community partners want to explore, and that sort of sets the stage for where we go next. So after defining the problem, we use activities called group model building to connect related variables and identify feedback loops and sort of draw this picture of a system that is kind of driving these trends that we initially talked about. And these pictures are called causal loop diagrams. And I wanted to show an example of a causal loop diagram because you're going to hear more about those from the next two speakers. So I wanted to kind of set a little bit of a foundation for understanding what causal loop diagrams are. And I'm going to exit this slideshow and actually pull up another program. I don't think I can make this one full screen, but hopefully I can see that okay. So this is an example of a kind of a presentation that walks people through a causal loop diagram that was developed by our partners in East Boston, which is a neighborhood in Boston. And so we have some information at the beginning of this presentation, and you all can access this presentation, by the way, right here. I can put it in the chat actually I think I can put it in the chat. In case anyone's interested in looking at that at another time. Okay, so this starts off with some information. It shows who's in the collaborative, what their organizations are. And then we wanted to give a kind of an example of how to read one of these causal loop diagrams. So here we have, fictitious example, but this idea of, chickens and eggs, like some people argue about which comes first, but in our diagram, you can start with either, basically, if you have more chickens, you get more eggs. If you have more eggs, you get more chickens. To just move my Zoom screen, okay. And so we call this a reinforcing mechanism. If you have more of this, it leads to more of this leads to more of this, and that can kind of spiral in either a direction where you have more and more or less and less. If you have fewer eggs, you have fewer chickens, fewer eggs. So these kind of reinforcing mechanisms can lead to either exponential growth or really rapid decline. And then, so that's one type of feedback loop where you have these variables connected to each other via arrows in a circle. Another type of feedback loop we call a balancing loop. So here with chickens, if you have too many chickens, you can have overcrowding in wherever they're living, and that can lead to fewer eggs. Maybe the chickens are stressed, they're not laying as many eggs. And so in this case, rather than more chickens, more overcrowding, it actually leads to less eggs, which leads to less chickens, less overcrowding, more eggs. So you end up in kind of this up and down pattern over time, usually kind of reaching some sort of goal in the system. So that's an example to show kind of some of the main features of a cause loop diagram. Basically, you have variables, you have arrows, you have some directionality with the pluses and minuses that kind of gives a sense of whether things are changing in the same or different directions. And then you have two different types of feedback loops. And as you connect these and build them, some very simple words and arrows can actually help explain trends that can be kind of hard for us to figure out on our own without the aid of diagrams and these kinds of pictures. And so this group, I'm not going to go through their whole map, but then we walk through their own cause loop diagram. So I'll just walk through a couple of things here. So for example, housing costs are really going up in Boston, and this is true, we know all over the country. More housing costs, more household expenses, more expenses. You have this gap between the resources that households have and what they might need, and that might cause people to work more hours. That brings in more resources to the house, and that helps to close this gap between what you have and what you need. And so it's a balancing loop here. I talked a lot about citizenship status. This community, there's a lot of immigration from all over the world, and that can influence their hours working, time available, time to spend with kids. If families aren't spending a lot of time with kids, that can lead to stress, which can make it hard to have quality time with kids. And I'm not going to go through all of this, but they just kind of build out, this presentation builds out this whole example of a cause loop diagram. Okay, so I'm going to go back to this presentation now. Actually, I want to pause and ask for questions, but I don't know. Maybe it's better to wait till the end. Okay, I'm going to keep going, but if you have questions, please put them in the chat. I'm happy to talk through them, and you'll see more examples. So hopefully the first time you hear about these kinds of things, it can seem like a lot and complicated, but you'll hear a couple more examples. Okay. So after we create these cause loop diagrams, we work together to generate action ideas and kind of put them up thinking about, are they likely to be feasible? Are they likely to have an impact? Is that impact likely to improve equity? So we sort of brainstorm ideas and start to sort them. And then we prioritize action, thinking about that local context, that systems perspective that we're developing when we're using when we're creating cause loop diagrams, and also reviewing evidence from peer-reviewed literature, from examples from other communities and other sources of evidence. And then we work together to implement programs and policies, and then try and sustain and evaluate that work. So these are kind of the Catalyzing Communities intervention steps. I spent quite a bit of time talking about how we define the problem and showed an example of a cause loop diagram that happens here, again, to lay the foundation for what you'll hear for our next speakers, and also to show where there's a lot of opportunity for community input and community leadership to lead the course of the project. So I wanted to acknowledge our team, many but not all of whom are listed and pictured here, and acknowledge our funding as well. So I don't know if we want to do questions now or if we want to go right into the next presentation.
Thank you so much. I think just because one of our speakers is going to have to hop up right at 2, let's go ahead and do the next 2 presentations, and then we'll start to ask questions. We'll go ahead and ask Sally if you will go next. And Again, folks, please, I'm jotting down my questions. Please either write your questions down so you don't forget them, or go ahead and put them in the Q&A, and we will work those questions into the discussion as we get to the Q&A. So Sally, I will turn it over to you, and we can see your screen, not necessarily in presenter mode, but we can see your screen.
Okay, sounds great. And I don't think this is my screen. I think it's somebody else's, but I'll just let to know when to switch slides.
Okay, so for whoever is sharing it, we are not seeing the presenter mode. The slideshow mode, in case that is helpful.
Great. And you can leave it on that slide. So I am Sally Wills. I am the executive director of a coalition named Live Well Greenville. And we are on a mission to ensure that there's equitable access to healthy foods and physical activity opportunities to address health disparities across Greenville County, South Carolina. If you want to switch to the next slide. Greenville is located, just so folks have some geographic reference, we're in the upper western corner of South Carolina, about halfway between Atlanta, Georgia, and Charlotte, North Carolina. So right along a pretty major corridor that connects us to some larger cities. Our work as a coalition is really founded in three main buckets. So amplifying community power, advocating for health equity, and advancing community collaboration. And these buckets really are a result of the work that we started with Tufts and the Catalyzing Communities project. So if you'll switch to the next slide. Our planning process with Tufts started in 2019. That feels like yesterday, but as I'm starting to realize we're ticking towards the 5-year mark, it's kind of hard to believe. But one of the things that we started with was this idea of we had long been working in policy, system, and environmental change. We had not been working at the outer rings of the socio-ecological model. So if you think about where policy change might happen, you go from individual to interpersonal, and you start to work out to organizational, societal, and community level change. And we were really hanging in that space of organizational level change, and knew we wanted to make a bigger impact as a coalition than we were making. And so we pulled together a planning group made up of a lot of grass tops leaders. And by grass tops leaders, I mean a lot of the folks who are in the C-suite, a lot of the individuals who are really in charge of making decisions. When we were thinking through this planning process, we thought that's who we needed to have at the table. And if you'll switch to the next slide, if possible. I know we're having a little bit of technical difficulty. I'm doing my best to just stay on track. We built out a causal loop diagram. We really focused in on our key question, which was, how do we start to address childhood obesity? And really from that point, moving further away from that to specifically addressing equitable access to physical activity and opportunities and healthy foods in our community. And while I won't get into the weeds of our spaghetti model, what you can see is there are kind of these global spaces that we pulled out for where we might want to focus as a community. And so looking at how, national and federal funding supports are, their eligibility and use in this top corner, really about like SNAP and WIC and how easily or uneasily it is to access, and is how accessible or inaccessible it is in Greenville County, and some of the barriers that exist around that, or the food environment, or what's happening in the home that either makes it easier or harder to eat healthy foods. So as we were digging into the idea of how do we turn this spaghetti model into a real plan, one of the things that we ran into as a coalition in our early days, and it took us more than 10 years to figure out how to address. I don't know if others are working in coalitions and if you can relate to this. We had great success in engaging gatekeepers, high-level leadership. We did not have great success in engaging local community members in our work. Often when we would start to dig into which policies or systems we might want to shift, we got into that space of speaking with a lot of jargon. I'm really conscious of that and hope I'm doing a better job of that in this presentation. We weren't making space for community members. And so even if they would come to the table, we would often overwhelm them with like our policy talk and kind of our public health speak, and just didn't make legitimate opportunities available for engagement and meaningful engagement in a way that really felt like people wanted to continue to work with us. Our coalition was very, very grounded in the space of being community informed. So we had great relationships with community members, with neighborhood associations, with the community members whose issues we were hoping to work alongside and address. We just had not figured out the actual interpersonal dynamics in a way to make it a meaningful opportunity on both ends. And as a coalition, we're really committed to that idea that there is mutual benefit for everyone who comes to the table. As we built out this systems map, and we were starting to build out the subsequent action plan, it just hit really hard and hit home at a time when we're in the midst of the global pandemic, because this plan was refined in 2020. We had not really, while we had sought out the voices, we had not sought out the engagement of the people who were most affected by the issues that we were trying to address. And so we took a step back, and you can switch to the next slide, and really look at how we start to meaningfully engage community members in our planning and in our work. And I think that that was a real switch for us in terms of how we do business, where we do business, and what business looks like for us as a coalition, to a very different model of work. And that model of work was about addressing health inequities and about building community voice and power, as well as the thing that we had done really well for a long, long time, which was advancing community collaboration. If we can advance by 2 slides, that would be great. If not, I can just work off the top of my head. Thank you. So we started down this path of community engagement, and for us, what that looked like was bringing together community members. The first effort was called the Food Equity Action Board, where we reached out to, I think we had more than 40 participants apply to be part of this board. It was a 6-month engagement process that had a couple of different goals, some of which was ensuring that community members who wanted to be engaged in advocacy and even activism had the skills and tools that they needed to be able to advocate on their own behalf, but also to ensure that the work of the coalition was grounded in the experience of those who, especially in this case, were experiencing food insecurity. We ended up with 16 passionate community members, made up of residents with a ton of geographic, age, cultural, and ethnic diversity, all of whom had experienced at some point in their lifetime or were even currently experiencing food insecurity, to help set the priorities for our food security coalition, which is, we have 3 smaller coalitions underneath this umbrella of Live Well Greenville. So there's the Food Security Coalition, an Active Living Coalition, and our Equity and Public Health Coalition. So as we wrapped up that board, we realized, okay, that was great, but we really feel like, oh, don't go back to the other slide, sorry. We wanted to bring in the other sectors of our work. So the first one was really about food security. So we created the Health Equity Action Leaders. We call them the HEAL Board. For this board, we were using it as part of a grant process that we had, or utilizing these members and their experience to build a plan for a CDC grant that we had. So it was not geographically diverse. It was really focused around one specific segment of Greenville County, but it was racially and ethnically diverse. We were able to do a lot around building community power, building community voice, getting folks engaged in the civic process about making sure that their voice is heard when decisions are being made at the local and state level. The group was equally split amongst African American and Hispanic or Latino community members. 4 of those community members were really not fluent in English, so everything was done with simultaneous translation and interpretation. So, and everyone was interpreted too. So it wasn't that the meeting was in English and all of the Spanish speakers were the only ones who were getting interpretation. It was simultaneous, and it's been super engaging. That board will actually wrap up next month. But it has been so successful and so powerful that we will have a HEAL board 2.0 that we're looking to make more of a permanent board that ensures that the work of Live Well Greenville is really grounded in the experience of our community members. Looking for 12 to 20 members who will serve a 2-year term. And this will ensure that we stay in this space of really building community leadership, amplifying voices, opening doors where we can, and ensuring that the work that needs to be done in the community is done really well. The other thing that Live Well's been doing since that first iteration with the Food Equity Action Board is trying to work towards a very purposeful shared leadership model. So where I said in the beginning, we didn't really have the space for community members to sit at our table. We are not only ensuring that they have a seat at the table, we're really trying to turn the table over to them, and that we work in the background to give the community members what they need to solve their own problems, knowing that we have access to some power and some money that they may not have yet, but we hope that we'll be working towards that space where they build their own power and are moving in that direction. So the last thing I'll talk about, and we can slip to one more slide, is just a little bit of food for thought if you are thinking about engaging community members, because these are a few lessons that we either learned the easy way or the hard way. The biggest one that we are really committed to is ensuring that community members are compensated for their time and their expertise. We started from the very beginning ensuring that every community member that showed up for any of those boards, or that have continued their engagement in any of our coalition work, they are compensated at $25 an hour. We explored what some of those tools were like and really found that we had some good tools, and were very justified in making sure that we were not only compensating them for their time, we also were looking to reduce barriers to participation. So we also compensate with an hour buffer outside of any of our meetings at $10 an hour for childcare, because $10 an hour is the going rate for babysitting. We also compensate for at least $15 per meeting for transportation, and anytime that we can feed them, we do, or we often will give a meal stipend as well. I know that those expenses start to add up, but we really feel like if you look at who else shows up at our community meetings, everyone else around the table is compensated for their time to be there, usually by their job. And we feel like that's a real key to making sure that it's just around the table and that we have some equity. We also are working very, very hard as a coalition to intentionally minimize power imbalances. Our team, who are mostly facilitators, have become very attuned to watching out for those power imbalances. So if from little things like when we put table tents around the room, we don't necessarily put an organization or something that somebody's title behind it, because we really want to make sure that people are showing up with kind of an even playing field. And sometimes those titles can set off a power imbalance right from the very beginning. When we conduct research, we report out to the community first. It's kind of one of the key examples of community-based participatory research. So when we are wrapping up our plan with that HEAL board, and they will receive the report first. They will have a chance to respond to it, edit it, change it. They will be listed as authors on it. It will be translated into Spanish from day one. so that the key members can all read it in whichever language they're most comfortable with. As a coalition, we are really, really committed to utilizing our legitimate power and understanding our legitimate power to not only open the doors, but turn over the keys to those doors to community members so that they can continue to build their power and their voice. And we work very, very hard to create a safe and trusted space. We do our very best when we say we're going to do something that we follow through. If something gets in the way, we're really quick to admit those errors or admit those problems and see if we can creatively solve problems together. So I can't say we're perfect along this path, but I feel like we have been really intentional. A lot of this work is coming out of the CLD that we developed along with Tufts, but more than that, really kind of an acknowledgement of something we got wrong and a way to set it to rights. One thing I did not mention is we have done subsequent CLDs with community members to ensure that the systems maps that we're working from and the causal loop diagrams that we're utilizing are really grounded in the true experience of our community members. And I think I touched on everything we had discussed. Here's my contact information if anyone would like to reach out or hear a little bit more about what we're doing. And I will turn it over to Dr. Greer.
Coming together to share our knowledge, our experiences, and to continue the work of looking at social determinants of health and how we as a community can make substantive changes in the lives of individuals so that all can thrive. Closing the gap on social determinants of health and an accelerator plan. We are looking at developing an implementation-ready accelerator plan in order to redress social determinants of health and the impacts of that so that everyone can work together, thrive together, and prosper in our community. We're all going to share together, resolve together. We're going to show strengths together with all of our lived experiences that we bring into the room. We looked at two focus areas: social connectedness within the community, within healthcare, within our whole system, and then also enhancing community clinical connections. Looking at those connections from the same standpoint of our community residents, from the healthcare system, and also organizations and people who refer in and who support individuals leading healthy and sustainable lives. We had a peer-to-peer session where we brought the community together so that they know that they are supported in telling their truths, and so that coming to an organization or a big group like this, that no one feels intimidated and your voice is of value. We had a nice town hall meeting at the Black Historical Society and Museum, wherein we brought together the health systems and the community together to really look at the issues that has affected individuals and to brainstorm solutions so that we are building on the voice, building on the ideas, the connections, and meeting individually with different groups and different individuals to get their input and some of their ideas and to better understand how we as a community can collaborate. So groups like the Milwaukee Health Department and the MKE Elevate Initiative, the Wisconsin Collaborative for Healthcare Quality, some of the organizations who are already committed to looking at the same kind of things we're looking at. We are trying to be what we call transparent so that we all are working in the same direction for the good of the community.
Economic access, access to quality education, access to healthcare, access to housing, access to community supports. That's what we know as social determinants of health. And for us at MCOP and for this planning committee, we acknowledge that those items do exist, but we also acknowledge that that does not address the full issue of what members of our community and of our state are currently facing. In a sense, those are warm fuzzies for us. So my name is Deborah Nevels. I'm Program Manager for Community Outreach and Engagement for Medical College and Wisconsin Cancer Center, Second Lieutenant to Yvonne Greer in projects that we are doing. And today I want to tell you why we feel that restorative justice is a better way to address some of the issues that are going on in our community. I mentioned the social determinants of health. As I said, those are warm fuzzies. That's the nice and polite way to say it. But we're beyond being polite. Children are dying. Moms are dying. Our community is dying. And we have to be bold and step out and say it and call it what it is. There are injustices that are going on within our community that are preventing our community members from thriving and growing and remaining strong. So for us, we can't just identify what the issues are, but we have to call it out even further and identify that there are injustices that are creating barriers for our community to thrive and grow. In order to address those injustices, we are taking a restorative justice approach. Now, true enough, this is something that you've often seen addressed when it comes to criminal justice. We're not too far from calling what's happening to our community criminal. And therefore, we're stepping up and calling it what it is and addressing it as it should be. We're acknowledging that wrongs were done. We're bringing the community voice to the table. We're listening authentically to our community. And that's you all. And working together and collaboratively to address the issues.
We want the community to know that they are empowered for the experience that they bring to us. Well, good afternoon, everyone. And I wanted to start out my presentation with this video because it brings to you the community that I represent, and it shows the diversity. It shows the progression from us doing the initial work the first year of developing our causal loop diagram maps as the new MCOP Healthy and Fit Strategic Planning Committee, to using those outcomes of those causal loop diagrams to apply for a CDC Social Determinants of Health Accelerator Action Plan, which was funded. And then now we develop a whole action plan. I have the plan here that was developed with community voice, with collaborative action, using a restorative justice framework, with supporting the community and being able to speak and tell their truth as true partners. We call our community members community member experts. So our community experts are at the table in with the health systems, and our health systems include insurance companies as well as community-based organization, grassroots organization, but also some of the biggest hospital systems around. And so all of these people are coming together from that initial work that we did with developing the causal loop diagram. That work secured this CDC grant, and now we just getting ready to submit an implementation grant, which is up to, hopefully we'll get funded $500,000 a year for 3 years. So this is the work that's got started with our initial partnership with the Catalyzing Communities, and we are now in our 4th year of that collaboration. So what I wanted to do, because I think if I start going into all of the different elements of all of the different things that's in the plan, that's also, some of the community engagement events that we did, because we did garden crawls, we did a community baby shower. It's called It Takes a Village. That brings in over 400 pregnant families every year. We're in our 4th year. I wanted to showcase 3 key elements that I found was key to our continued leadership team engagement, our community member experts and health system partner engagement in this effort that is expanding, that is kind of positive. There's an energy around it. And then also our engagement with Tufts University as a key partner. Tufts have been right there with letters of support, supporting us, and we are writing in the items and things that the community identified into all of the grants that we are developing. So my first one, as far as what I think is really key to what we've been doing, is relationship building. You really have to have good relationships and bring an attitude of honoring the voices and the lived experience that you bring to the table. With our strategic leadership team, we were able to empower them to not worry about statistics and data and percentages of this and that we've heard so many times, the same thing over and over again that never changed, but to dig deep into themselves and tell their experience, tell their truth, tell what they see in the community, what they see changed over time, and to develop those causal loop diagrams based on the lived experiences that they brought into the room. That was so key to this. But one other key thing when you're talking about developing a relationship with a research institution like Tufts University and local community, you have to build trust. The relationship and trust that you build with the local individuals and the research team is so very important. You have to make sure that everyone feel comfortable to be their authentic selves and to be able to tell their truths, even in uncomfortable situations, having enough trust to be able to say, this is something that I don't agree with, or this is triggering me, or this is, to be able to say it how you feel it, so that you're not carrying around, distrust or any type of anxiety about the relationship. And I think that, when Tufts came, they came with the idea that they were going to be that type of an organization, that they were going to authentically listen. They were going to have those hard conversations, and they actually helped empower individuals to be their authentic self and tell their truth the way they see it. The other thing that I wanted to make sure that we brought out is the idea that when you're looking at bringing people together in order for them to really feel that they can tell their authentic truth, we use the nominal group process quite a bit. And that's where you give each person a chance to comment on whatever the topic is, whatever the subject is. If we said hopes and fears, they were able to say, what is one of your hopes? What is one of your fears? So that the loudest people in the room are not the only ones that being heard, so that the quiet person, their voice is heard as well. And so that was used in many situations, especially when we had table discussions and we had facilitators who were trained to make sure that they use that process so everyone's voice is honored. Even if someone is disagreeing, we want to hear the disagreement. That was part of the respect and honoring and the relationship building that happened, not just in the beginning, but also with our community members. And that peer-to-peer session that I talked about in the video was where we actually had a special session for community members so that they can talk about their hurts or their pains or however they wanted to tell their truths. And we can help them express it so they're not blindsided in front of a whole group. They had an action plan. They came prepared to participate and ready to say, what is it that I want to see happen? And believe it or not, they felt that no one had ever asked them to do that or prepared them to do that. And some of them at times said that it was at the wrong time for me to meet. They took vacation days from work so they can be there. That was not something we anticipated, but it was showing the commitment of community members. Once you honor them for the expertise and the lived experiences that they brought to the table and their knowledge of the community and what they want to see done. So the other part is, in order to really make it wherein people felt comfortable to partner with us, I set out to make that true transparency. I said transparency in the video, the transparency of purpose, meaning that we disseminated information, we went to different events, showed up, said who we are, invited people even before we really got started with the work, so that there was, if they heard about what's going on, oh yeah, they're doing this, maybe we should go to that, and had people wanting to come because we went to their events, we supported their events, and the idea that we're all working for the same community. So the Milwaukee Health Department's MKE Elevate initiative, part of their community health improvement plan, I go to that. I'm part of their action team. They come to mine. They're part of our initiative. They're using some of the things that we're doing in their action plan. And I had them come meet with the team, and we are going to partner with each other. So we're all moving together in the same direction. That has created so much energy around this process. So that transparency of purpose. We also selected the age group 0 to 5. The Children's Hospital of Wisconsin did some similar work for ages 6 to 12. So before we ever got started, we really looked at what have our community did in this area, and what population do we feel we could most impact. And that's how we picked our 0 to 5. And then the Children's Hospital initiative went from school age to high school age. And so we're not competing with anyone in the work that we're doing, and we're supporting other initiatives like WIC and many others that come to the table with us. So the last one I wanted to make sure, this is a big one. And I know that Sally had touched on this in what she does, but I wanted to bring up it even more, the true commitment to shared power and recognition. This was very, very key, because at times, you know, when you're talking about a community that many times has trauma, has had abuses as far as being minimized, whose ideas have not been brought to the forefront, is the last group at the table, last people to be asked. This is really important to understand that commitment to shared power and recognition has to be there from the beginning, and that you have to understand that if you're in I call it in the privileged area, if you're in the privileged, I could even call myself in the privileged area, but I am part of the community. So when people know your mom and daddy, sister, brother, you're not always, they don't feel like, even though you might have this doctor, they're like, you just Yvonne. So just keep that in mind, that they consider me part of the community, but I'm also part of the academic community as well. But when you have those privileged, sometimes people can feel that you are thinking that you're better than them, over them. So this power dynamics have to be really intentionally looked at. And that's why I intentionally make sure people feel welcome, that their voice is honored, that we're going to work for consensus building, that if you don't like something, that's what we want to hear. We don't want you to feel intimidated. This was something that we looked at. So throughout the initial planning, implementation, dissemination of outcome, all research team members and the local leadership team members, we respected their time, we respected their perspectives, we acknowledged and work with them for mutual agreement and consensus building, and to mitigate the dissenter. So if we have a dissenting voice, we work with them, we talk with them, we see if we did this way, would that, you know, make it a little bit more agreeable to you? So those types of things. And sometimes I had a lot of side conversations too, because like I said, sometimes people, even when they bring up their strong feelings, you know, they worry that they are offending other people. We took the offense piece out of it, that we're all here to talk, to conversate, to be in this together. Your ideas is just as important. And if you do not like something, speak up. We want to hear it. And that happened quite a bit. But we wanted people to be their authentic selves and understanding trauma and how that can affect people being their authentic self. We wanted to, we stopped saying safe spaces, because sometimes safe for one person is not the same as safe for another. But in essence, we wanted people to feel that in this space, they can be their authentic self and participate fully in the conversation. To the one thing that Sally said, we also had interpreters come. We also did Zoom, because in Milwaukee, people live on other sides of the city and different things, and they don't cross the bridge. So we did have everything hybrid. And then we found out that was a little bit disconnect by having an interpreter on Zoom and breakouts. So we decided to have full Spanish speaking breakout sessions and full Spanish speaking tables. So we might have saw a table with a laptop on it. That's because that was the full Spanish speaking table, and the ones that was hybrid were at the table with the Spanish speaking table and communicating in Spanish. And even in report outs, the report outs could be done in English or Spanish, whichever one they felt comfortable with. And we had the interpreter there to interpret. And they did decide, you know, some to to report out in Spanish versus in English, and that was perfectly okay. All were offered to share in the dissemination of outcomes. We had user-friendly, make sure that the report was easy to read, user-friendly. And we had the community members evaluate the reports before they went out to make sure they saw themselves in these reports, that they felt that this captured their feelings. And if it didn't, we changed it. And again, we had a full Spanish-speaking review team that we only scheduled it for 2 hours. It went 3 hours plus, and no one wanted to leave because they wanted to make sure that they reviewed that document and their voices were heard in there. And then all were offered to, okay, I did say that was one last point that I wanted to make. We also shared that first year, especially, we gave out certificate of appreciation, but when in looking at their time commitment, we didn't assume that people are just going to continue with us. We got a 1-year program and then a 3-year grant, continuation grant. That would have been 4 years. At the end of each year, we celebrated what was done in that year, and we gave people the option to recommit. Because if their time changed and they couldn't commit, we wanted to honor them for what they did and not assume that they're just going to continue on if their time. So that gives them a time to reflect. And also, even though some may have, we only lost maybe 2 or 3. So we had a leadership team of like 13 and maybe 3 didn't come back. So then we had 10. Then we now have, I'm going to have another different leadership team, and we have at least 7 people already committed to coming back. And we're looking at an 8th person. So we may have like 2 spots open or something like that. That really made people really feel comfortable about continuing doing the work and that type of thing. And the ones who do not come and recommit at the end of the year when there's celebrations, they get invited. They are not left out. And so that's another way of honoring them. The last thing would be the idea that not only are we inviting them to be part of this new grant, we also are doing a manuscript to be published on the first year of our commitment, because it's been so successful as far as where we've been headed. But that base of that color loop diagram, that bringing the community together, looking at their hopes and their fears and their mental models and all of those things that we did, that is going to be published. And we wanted everyone to be able to be recognized. So all the committee members have been invited to be co-authors, and only 2 said that they didn't have time to review the document and be in that space. And they are going to be acknowledged in the document. This was very important. In Milwaukee, there have been documentaries. There have been all kinds of people coming into Milwaukee to do different things, to report on, we had some unrest and different things. And so the problem that people in Milwaukee see is that people come in, they reap the benefits of reporting on Milwaukee and the people in Milwaukee, and the people in Milwaukee don't reap the benefit. I just went to one of our partners, Andre Lee Ellis, who has a community garden program that educates young boys, and he signed his conflict of interest paper as a co-author. He announced it to the boys at the garden. He signed it in front of them as inspiration. And he said this would be the first time that he would be published. And they all clapped. And the idea that this is something that they never thought was in their realm of actually sharing their work and their experience and their ideas, and to be integrally part of this, that was very special. And so it was a little bit of work for me as one of the persons trying to coordinate all of these things, but the rewards is just so special. And so I wanted to bring that part about out because working with Tufts University has been a learning experience. It has been an experience that built trust, relationships. I always tell people, and I always be my authentic self when I do my presentations, that I always tell people I got a little PTSD in me. When you suppress your true self, sometimes it comes out as anger, sometimes it comes out as anxiety, and sometimes, you know, they say if it's a duck, it's a duck, it's a duck. Well, sometimes when you start feeling those type of anxiety and you don't feel you can speak up, it festers in you. In this situation and in some of the situations I'm in now, we're trying to break those barriers down. So not only am I learning how to speak up when I know it's bothering me, but the trust that when I do speak up, that we can have a real conversation and come to some kind of agreement, consistency on how to move forward. That is so important. So the other part of the other side is becoming allies with each other. And that's part of what I sometimes feel has been missed in some of the relationships in the past. Once you have that, it's beautiful. And I think we have it, and it's flourishing. So I'll end with that. So thank you.
Thank you all so much. This has been a great set of presentations. There are so many gems that you all dropped. And so I'm going to have to go back and watch the recording again. I do want to invite Sally and Larissa, please, if you could come back on camera. There are some questions. We have probably about 12 minutes or so for folks to drop questions in the chat. I will say we'll loop back. I know, Sally, that you have to leave shortly, so I do want to get to one question that you wanted to speak on. And then we'll go back to some others. If no one else has questions, I have 3 pages, so I'm super excited. So the first question that's in here that I think, Sally, that you wanted to speak to was a question that came in around time-limited funding, and how you can how can communities work with you all, knowing that funding may be limited to a year or two. And I also had a question related to that. So if you could speak to that, but then also from the Tufts team, and then, Dr. Greer, whoever, knowing that you were able to successfully figure out how to leverage the funding that you got, Dr. Greer, to be able to get your own funding. Talk about what resources or what things you needed to have in place to make that happen, and what advice you could provide to community organizations who are entering in these relationships, so that everyone can be set up for success at the end. So Sally, we'll start with you, since I think you said you wanted to speak to that, and then if those of you could talk about, what did you do to build your capacity to make sure you were ready?
Yeah, thank you for the time, and I'm going to do my best to stay on until 2:30. We might be hauling up the road very quickly after that, but this is just such great work. I think one of the biggest things that we did as a coalition, I think this is a key piece. We are a coalition, as is Dr. Greer's organization. This will not work for programs, so just keep that caveat in mind. But as a coalition, we have a mixed funding model, meaning that we don't have just a single source of funding that is supporting all of our work. And we really pushed our entire organization, from our partners to our community members to ourselves, to have a mental model shift as we think about funding. So we utilize funding as a catalyst for the work we know we need to do. So everything at the very heart of everything that we do as a coalition is centered around the work that we know we need to do. So when we have more funding, we can do it at a more rapid pace. We can bring more partners along. We can help to support others. And when funding is more limited, as it has been through our history, we just draw back and we move a little slower. So we really started 14, 15 years ago with this mindset that we would never actually go into a community and tell them we're only here for a year or two. If if working with the community is the right work that we're supposed to be doing, it may take us longer to accomplish what we need to accomplish, but as long as our organization still exists, we will continue to work in that space. And that is a mental shift. It is, we didn't build our coalition because of a funding opportunity. We utilize the funding opportunities that have come our way to push our coalition forward. And so, like I said, does not work for programming. If you're going in to provide individual behavior change models or things like that, you really need a very sustainable source of funding to do that. But from a coalition where you can pull from a lot of different pots of money, and some of those pots come in the $500 range, and some of them come in the $500,000 range. So being creative with that, but also making sure whatever it is we propose to those funders matches and aligns with what we've told our community, or what our community has told us they want, and what we've told our community we will seek opportunities to fund and move forward. So just, I always try to put that out there so that so people can start thinking that way, because that is part of what breaks trust with community members, is if, oh, well, we have a 3-year grant from the CDC, so we're here for the next 3 years. No, you're here for the next 3 decades. And this grant is going to help us do some work for the next 3 years.
I didn't know, Larissa, you want to go? I can comment. Well, same as Sally. We are a coalition of organizations. And so we've been around for now, this is our 18th year. And we started out as a small WIC work plan to develop a Milwaukee County Nutrition and Physical Activity Coalition. And then we got a $400,000 Robert Wood Johnson Healthy Kids, Healthy Community grant. And then we, transferred and completed that. And then we said, oh, well, what do we do now? And we said, why do we want to keep meeting? And we said, because we have a passion, we have a mission, we have this and that. And so we did strategic planning and developed our mission statement with the same acronyms of the Milwaukee Childhood Obesity Prevention Program, MCOP. We changed it into Milwaukee County Organizations Promoting Prevention, because we said we don't want money to cause us to not work in our community. We're committed to the community. So we develop our mission, vision, and value statement together for almost a whole year. So in 2015, we became Milwaukee County Organization Promoting Prevention. And for 3 years, we had no money. But we developed relationships. We did get sponsorships to do Back to the Kitchen conferences, not Back to the Kitchen, Days of Learning. I'm doing Back to the Kitchen websites as part of our new initiative at MCOP. But we took that time to fine tune what were we about. We also made sure we kept the relationship going. So we have neighborhood centers that ONCOM has 8 different neighborhood centers, and that's just one agency. So we had relationships with, all the universities. So all the players that were coming to the table for the Childhood Obesity Initiative decided we're going to continue. Because of the relationships that we had, not only in the city of Milwaukee, but statewide. When opportunities came about, the state could say, we're looking for a coalition to do this in Milwaukee. We became the go-to coalition because of the relationship that we built up with the state, coming to some of their partnership meetings, some of the things that they're doing, and just giving our advice and being on the committees. So it wasn't that we, again, had continuous funding. We had many times we had no funding. We participated into the Wisconsin Healthy Institute, wherein they looked at how to develop coalitions. and we brought a team to that. And then they funded us to do a project, and we developed a role modeling action guide for parents. And it's still in use at the City of Milwaukee Health Department's website, free to anyone, with lesson plans and all sorts of things. So it's because we continue to work, we continue to put out some products. And sometimes it was the agencies saying, okay, we're part of the ONCOM, we'll provide the box lunches and the space to meet. We'll donate this, we'll do this, we'll do. And so during those lean years, we all just stuck together and we kept the mission going. We had our meetings be an educational piece, a coming together, sharing. So we decided, what can we do? We're conveners. So we defined what is it that we really can do with limitations, and then when opportunities came up, then we used them to advance whatever else we wanted to do. And that has worked. That has worked, and it's built reputations. And, you know, like I said, being a go-to coalition, we are go-to because we said, yes, we can do this work.
That is fantastic. Thank you so much. Larissa, I want to ask you, because there are some academic researchers who are attendees. And we know when you're an academic and you have to get grant funding and you have to publish to get tenure, and sometimes you apply for things and you do have a limited amount of time and you may or may not be able to fit within how things work. Can you talk about how your experience as an academic researcher fit with working with two organizations that were existing coalitions that are in it for the long haul, but then you have some funding? How do you reconcile that with being an academic researcher? And then how are you able to still be successful given that some of this work is slower?
Yeah, and I just want to recognize, like, many of us work in both of those spaces, including Dr. Greer and the academic space. So I think it's part of it is how you frame your research. And so to me, I've worked with multi-sector groups and conducted research. So we're like studying what is happening with these groups. So it becomes a research question about how do you make change in communities. So I think sometimes it requires, you know, thinking about your research in a different way, maybe talking about it in a different way, and figuring out how you can sort of fit some of what you want to do and what you think is really important for community change into some of the big questions when it comes to how do we promote public health. Because there is a lot of research, you know, ongoing research about community coalitions, and there's also, this fits well into this topic of implementation science. We have general ideas of what works when it comes to health promotion, disease prevention. We know social determinants of health are huge drivers. We know racism. We know social and structural drivers of health really drive health and drive trends. But how do we actually address them? That's that implementation science. How do we do that? That's where I think partnering with really trusted community organizations like the coalitions here help bridge that academic question of how with actually how to me. So I'll let someone else join in if you want to say anything.
I also want to, you know, reiterate the idea of community-based participatory research, is that really understanding that it's not just community in the space of community, it's actually bringing that participation and honoring the community in that. But in that space, you have to do the evaluation piece. You have to have it in place. It has to be, and sometimes it's an education piece that has to be done for the community members. Why do you need me to do this? What is this survey about? But you still have to be intentional of getting that done. And I think that's another reason why, you know, we've been successful, because everything we do, we think of for MCOP as almost a community-based participatory research, and we're going to have evaluation, and we're going to be able to present our findings, and we're going to be able to present what did the participant or what did the individual feel, think, and how did they change. We do that everything that we do. And so when Larissa and them came, it was not a big leap for us to be able to participate with them and do this, but they had specific things that they did, and we had already touched on causal diagrams, but not in the same way. So this was an education for us. We were on board, and we were able to make sure that the community was on board as well.
This is so great. I'm like, oh no, the clock is running faster than I want it to. I have one more question. I will say for folks that are listening, if you scroll up, there were some questions that were asked about some of the resources, and the presenters were so kind as to put those in the chat. Please scroll up and make sure that you grab those links and resources. I have a specific question about language that hopefully we'll have time to get to. I think earlier, Sally touched on this, and Dr. Weir, you said this as well. You talked about community-based participatory research and being participatory. Sally, I think you mentioned the difference between research that is community-informed versus community-engaged. A lot of time when we do research with communities, we talk about things like our community and inviting people to our table. And giving the community power with the assumption that we have the power to share. As we think and we work with academic researchers or people who are coming from outside communities, do you have suggestions for different language that we might think about using that's more inclusive so that we are not approaching things in a way that makes it feel like we are coming with the resources and we are giving it to you? Because we are saying that we want to acknowledge that the community already has power. The community members already know. We are actually learning more and taking a lot from community members, but the way that we present is this is ours and we are allowing you to be a part of it. What other language might we use, or what might be different ways that we could say what we mean to make it more inclusive and participatory, community driven, even community led?
Yeah, I think like everything along the process of becoming just a more global citizen and a better human, in my perspective and in my opinion, is just continually learning and trying to do better. And I will say, as a coalition that serves a community that is not always as diverse and as inclusive as it needed to be, we have really been on a mission to be better and do better. And so part of that is just acknowledging that words matter. You know, it's just like what you were saying, Melisha. It's like, you know, we started to say like shared power, or haven't used the term empowering in a long time, but it does imply that power is someone else's to give rather than your own to take, and just in a light that you can step into. And what you often need are the skills and tools to be able to tap into your own power. And so what our team has really done is look at, you know, what keys do we own that we can help and share. And I'll never forget, right as we were starting to shut down for the pandemic, our community was recognized as a Robert Wood Johnson Culture of Health Prize winner in 2019. And I was going to one of our municipalities for their city council meeting to share a copy of the award with that community. So we wanted to make sure that all of the municipalities knew that this whole county had won the award. And so I was there, and I don't know if any of you in the audience have presented at a city or a county council kind of meeting, but there are rules around that. Like, so I knew the rules and reached out to the city administrator before I came to the meeting and said, you know, I'd love to be able to present this. They told me I could do it during open comments. Locally, to do that, you have to get there at least 30 minutes early and sign up for the time, and then there's a time for open comments. I had followed the procedures. I happened to be sitting next to a gentleman who cared a lot about a zoning piece that was going on in his neighborhood. He did not know the rules. If I had known at the time that he didn't know the rules, I would have gladly shared with him the rules. But we had open comment. I got up and gave my presentation, and I sat back down. And when they got to the part in the agenda to discuss the zoning in his neighborhood, you could see him, he was holding rolled up pieces of paper. He had made a script. He was ready to talk about why this was important to him, and they wouldn't let him speak. And it broke my heart, because I was like, here's a passionate community member who has something to say about his own community, where he lives, and this ordinance that will have an effect on his day-to-day life, and he didn't know how to engage. Of course, with one person afterwards, I stopped and at the break and said, I'm so sorry, this is how you do it. It was on the third reading, so it had passed. Like, it was, he did not get a chance to speak. I think that's what I think about every time I think about community engagement, is that there are often spoken and unspoken rules. And if I am aware of the spoken and unspoken rules as a citizen or as a community member that cares a lot about what's going on in this community, if I can share those rules, if I can share those norms, if I can share those levels of engagement, then I want to. And that's kind of everything from language to, interpretation, all of that. And I'm sorry, I feel like I took up too much time in explaining that, but that's kind of where we come from, and how I try to frame my own reference in all of this work.
That is helpful, and a helpful example of how you can use your privilege and your knowledge to get people into position so that they can be engaged. Dr. Greer, Dr. Colinzi, either one of you want to speak very quickly to the question about language? I know we are slightly over time, so we do need to wrap.
I just want to say I did put that into the chart in the chat, that we use a lot of times community-centered solution, community-centered actions. We use that is centered on the voice of the community. We don't always say that, we want just community engagement. We say that we want you to be part of our group as one of our consultants, our community nutrition, our community expert consultant, to give us your expert opinion of and from your lived experience on what needs to be done. So it is changing the wording, but community-centered is really something that the community seems to understand.
Yeah. Thank you so much. This has been just a fantastic presentation. On behalf of the Council on Black Health and on behalf of Catalyzing Communities, we want to thank those who attended the webinar, and I'm certain that there will be people who will be watching this over and over, so the live link will be coming soon. You all have dropped some gems, and I look forward to going back and watching this again. Thanks to all of you who attended, and we look forward to engaging with you next month for our next webinar. Have a great rest of your day, everyone.
Hi, everyone.
Thank
Take
you all.
care.
It's a privilege.
Thank you.
Thank you.